Welcome to It's Your Case, presented by VetCT.com. I'm Amy Zalcman, your radiologist on demand for this week. Today we continue with our theme of Don't Get Your Gastrointestinal Tract in a Twist. Today's case is a 1-year-old male neutered Dalmatian who has acutely collapsed. There has been no observed vomiting or diarrhea. His clinical exam reveals mild pyrexia, tachycardia, and severe dehydration. He has tense abdomen upon palpation, which also produces mild thylism. His biochemistry and hematology show signs consistent with severe dehydration and nonspecific inflammation, including moderate leukocytosis, moderate neutrophilia, monocytosis, eosinophilia, lymphopenia, and his coagulation times are normal as well. The small intestinal segments are moderately to markedly dilated, but are inappropriate. They are parallel to each other and have a mildly swirling pattern and lie within the cranial half of the abdomen. These segments are inappropriate in terms of their distension. The gastric silhouette and large intestinal segments are within normal appearance. There is moderate reduction in serosal contrast with a wispy soft tissue appearance along the ventral abdominal fat. The liver and urinary bladder have a normal appearance. The splenic margins are poorly defined but are suspected along the left body wall, and the renal silhouettes are poorly defined on the ventrodorsal view, likely due to the changes observed in the small intestine. The abdominal boundaries are within normal limits beyond the fact that the patient has 6 lumbar vertebrae. The presence of multiple small intestinal segments that are distended with gas and stacked, but specifically in a swirling pattern, are indicative of a segmental gastroenteropathy. But the segmental gastroenteropathy does impact a large portion of the jejunum. Our differentials include a mesenteric volvulus, segmental enteritis, or vascular compromise, such as infarction or thrombus. Peritoneal effusion is also identified, and this can be inflammatory or hemorrhagic. Segmental enteropathies can represent a multitude of differentials. However, there are certain features of this case that heighten our concern for mesenteric volvulus. Mesenteric volvulus specifically refers to the rotation of a portion or the entirety of the jejunum about the mesenteric root or vascular root of this intestine. Specifically, in this case, the appearance of the small intestine having that whirling pattern, the peritoneal effusion, and the collapse of the dog with abdominal pain heighten our concern. It is critical to recognize this differential early as it is a time-sensitive surgical emergency. Early intervention to derotate the volvulus is important for reperfusion to ensure viability of the small intestine. Segmental distension will progress as the vascular injury becomes more protracted, and this is why early intervention is critical. Computed tomography can be useful in confirming this suspicion. However, this may delay the patient's arrival to the operating suite. Be sure to view the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.